You will take care of people in this room. I will take care of people in this room, and you will take care of it. Okay. And good. Can I see here? Okay. So, given the practice, you can tell us which one of these devices, right? Okay, good.
ยังไม่เลิกเลยเนี่ยเลิกกี่โมงเนี่ย
นี่ก็จะไม่ทำสไลด์หรือว่าจะโชว์
พี่ว่าน่าจะโชว์แต่ก็ไม่รู้ว่าใช้ยังไงมองไม่เห็นหนูก็เรียนรู้อยู่คุณถึงต้องไปหาหมอค่ะด้วยซ้ำ
ผมไม่อยู่เลย Thank you.
คือจะต้องคือไม่ได้ไม่ได้ไม่เลิกเลยเขาไปเช็คเครื่องนี้แล้วเขาหา
You will start soon. You. Okay. Thank you. Okay. Yeah, the devices need to check everything in the computers. Yeah. So this is great device. Mine does not check stuff. So sometimes it's broken. Not very please. Good. Okay. First question is how many people want to use that online? Right? The second is who has not been used devices, who hasn't used it before. Good. Okay. How to make you know how to use that awesome today in 3 hours. It's only one know how to use it. 7 of you know how to use it this morning. And maybe 2 or 3 of you joined my class 1 year before from here, 1 year before from now. Okay. Alright, don't worry. Let's start the lecture today. Okay. I don't need to introduce myself, and because I have been here for this is my 10th time to come here, visit here. Yes. If you include the online visiting professor, that'll be my 90. Because there was a gap I cannot be physically here during the COVID. So yeah. Today's lecture is designed for people who already know lots of them. Yeah. But it's okay. So we will start from the start from basics of the ultrasound. That will be 3 days lectures. Yeah, the first ultrasound lectures from the shoulder to the ankle, include the downfit train. That was a 5-day lecture debate. It is hosted in on T19. Yeah. These are 5-day lectures, and we staff at the Miami University. We prepare the lectures 3 days before the 5-day lectures. So we actually doing the masters for 9 days. When the lectures finish, we take off our mask. There are a lot of compression on the ears. Yes, the people like to learn how to use ultrasound, even though that time is very difficult. Right? Since we are going to skip the basics of ultrasound today, I'm going to give you some concepts. Okay. Right. Today's focus is about our lectures is dynamic, doing the dynamic, and doing the dynamic testing for the sports injury. So I teach at different hospitals, two different hospitals, and one hospital where I got my full-time job is I teach physical therapy to use ultrasound. And I teach another hospital, Catholic hospital, and I teach medical doctor for their PGY training. Yeah. And I often be asked about to teach skill, the ultrasound scanning skill to physical therapy and medical doctor. What are the main differences? What are the main differences? Medical doctor would like physical therapy to use ultrasound to help them to arrange the following treatment very quickly. Okay. It's so basically in the Catholic hospital, I teach PGY students to use ultrasound to scan the problem in the patient. And the PGY student, medical doctor, PGY is post-graduation period. It's kind of the first or second year of their residency training. Just like a physical therapy graduate from university within 1 or 2 years. So the young junior doctor need to report to the senior doctor after the scanning the patient and discuss about the rehabilitation with the physical therapists who are waiting outside the clinic. Right. So it's about the patient see the doctor refer the patient to the junior medical doctor and me for scanning, and within 10 minutes or 15 minutes we need to complete the scanning and complete the report in the next 5 minutes. Yes. And the junior doctor is going to bring the report to the senior doctor. The senior doctor is going to talk to the physical therapist. So basically, the whole process will be complete in 30 minutes. Yeah. 30 minutes. From the first interview to the first time to have the physical therapy within 30 minutes. And the patients are superb, happy, and satisfied. Right. So when I teach the medical doctor to use ultrasound, they need information for diagnosis. But when I teach physical therapy to use ultrasound, it takes 30 minutes, yes, equally about the same time, to evaluate the tissue under stress, the change of the tissue under stress, given by physical rates. Why? Why we need information about tissue deformation under stress, especially under the physical examinations. That different to the skill required by medical doctor. People who grew up in Malaysia, please raise your hand. Where's your right hand? Malaysia? No. Okay. Because I talked to the people in Malaysia the past Monday. They had different opinion and concern about using ultrasound. They said, I'm very curious about using ultrasound, but I don't want the medical doctor confused with this. Yes, don't worry. The medical doctor needed a skill for diagnosis. Physical therapy needed a skill to observe the tissue deformation under the physical examination. Why is that? It was not so attractive before. Why? Recently, the tissue deformation become very attractive to research, to the clinical work, and to also to the physical therapy. Why is that? Because the tissue deformation under the stress represents the mechanical property of the tissue, right? And the mechanical property of the tissue is one of the important factors to performance. So medical doctor needed a skill, a scanning skill for diagnosis. Physical therapy needed a skill for tissue deformation and use the deformation got from the ultrasound to explain the functional defects. If the skill that I teach to both groups are the same, there will be confused. Yes, there will be a confusing. Physical therapy use ultrasound going to make medical diagnosis similar or the same to the medical doctor. That will be a confusion between the our physical therapy roles, right? So physical therapy mainly use ultrasound to observe the tissue deformation under stress, under physical examinations. And we use the result to explain the functional defects. Okay. So, what are the physical examination has been combined with the ultrasound before? Are they good? And what are the physical examination should be combined with the ultrasound and has not been used before? Only use ultrasound, only physical examination without any ultrasound. Can they be used? Okay, then we will start practicing and do a little bit brainstorming. Alright, how many audience in here you are postgraduate? Post. Please raise your right hand. Postgraduate. You are research student. Yeah. Good. Right. Clinical physical therapy for already practiced in the clinical work. You are working now. So are you undergraduate student? Undergraduate? Yeah, postgraduate, yes. Okay. So you are research student, right? Okay, you are the research student already. Okay. So you are research student as well. Okay, good. Because for the undergraduate student, they are not familiar with the physical examination that we are going to talk. Okay, so, right? What is dynamic ultrasound? So, in the future, if someone asks you, what are the differences of the skill using between the medical and the physical therapies? Physical therapies are more focused on dynamic ultrasound. Dynamic ultrasound is different to the static ultrasound. The dynamic ultrasound is performed during the active motions and the stress. You can say that already, okay, so sometimes the physical examination is provocative. So that means we give the stress to a tissue. Or the tissue that we are targeting. And we look at the deformation. And we do not only look at the tail, we also look at the hyperlaxis. Okay. And also the joint stability. Okay, so if you look at, if you use the PubMed to do a research review, and you will find several very, very useful and important dynamic ultrasound scanning has been recognized already. First one is elbow valgus stress test, combined with ultrasound scanning. If the joint space gets widening during the valgus stress, and the size differences greater than 1 millimeter, that is evidence to show the injury in the medial peripheral in the elbow. And the sensitivity is good, specificity is good. So my colleague, they are medical doctors. They asked me, this kind of you are making diagnosis. I said, no, we didn't make a diagnosis. We measure the deformation, and the results of the deformation lead to the conclusions. What we do in our clinical practice, we establish hypothesis of tissue injury, and we need evidence to prove it. Okay? So, if you are doing, when I studied in UK, the teacher who teach me to use ultrasound, he is a radiologist. And he often told me, because my name is Leo, when I was a student, he often told me, Leo, physical therapy is the best art, is the best stuff to perform ultrasound. Why? You are a radiologist. And he said, radiologists, depending on, or rely on MRI, CT, DEXA. And these devices does not ask the radiologist and do not take a lot of time to learn. Radiologists need a lot of time. The learning curve is too long compared to other devices. The learning curve for ultrasound is too long, longer than the other devices. So basically, radiologists get conclusion, diagnosis results from MRI, and we recognize muscle. Muscle is the key for physical therapies doing your evaluation. Yeah. I'm very glad he told me. Last time I went to Sheffield University to visit him. he's already retired, and his junior staff stay. Now she is the head of the ultrasound education center at the Sheffield Harvard University. So use the dynamic evaluation frequently and help you to know about the mechanical property of the soft tissues. This one, the article was published in from the 2016, and the references I gave to you is published in 2025. It's a very new one. But why I said the article was first published in 2016 because when I studied in Sheffield, we use this kind of skill already around 2000. Yeah, and there is no any article discuss about the specificity and sensitivity until 2016 or 2019. So dynamic evaluation is not so familiar to medical practice who are going to prove the sensitivity and the specificity of our physical examination, physical therapy. You have to do this. Otherwise, medical doctor will look at the MR. They will look at the CT, right? And then they will find the evidence from morphology. The mechanical property cannot, the information of the mechanical property cannot be offered by the morphology. Mechanical property information can be only gathered or collected with dynamic movement. So this is the skill I often use in my clinical work. Okay, so basically subject is supine, and you give them a little bit radius about 5 Newton. Okay, so basically you can ask the patient to relax, okay, or use the gravity. Take the first one and give them a little bit stretch. Okay, do they feel fear or pain, and you stop and look at the widening of the joint space. Right, okay? So when you perform the dynamic testing, you need to know how many people in your team. If you are going to apply the test by your own, you need a pedal for freeze. Pedal. Because you are not going to be able to freeze the screen, right? So you have to have a foot pedal. If you have only one person to do that, just you to do the job. If you have two people, that would be very simple. You can have someone to help you to freeze the screen. That's why I said I need an assistant today. Okay. Right. So now since you are, most of you are not familiar with ultrasound, I have to modify my lecture today. So I will give you an idea about the tissue deformation. Right? Okay. So I will carry out the demonstration one by one, not in the end of the lectures. Otherwise you will be So, right. I need a stronger. Yeah. I need power with the elbow. Good. Right. So. Okay. And let me explain again. This is the media modal. Media modal. Okay. On the top of the we need to find the humoral tropic in the left side. Left side in the image always represents the proximal part. Proximal part. So this is the medial modal, okay? And the right side is the sublim tubercle of the ulna. This is sublim tubercle of the ulna bone. So that's where we can find the insertion of the ulnar collateral. And the joint, the space between the trochlear and the sublim tubercle is the parameter that we are looking for. Or you can also include the length from the sublim tubercle to the top of the medial condyle. So you are able to see the distance between two bonding structure and their relationship between the space divided. Okay, so you need to lie down face up.
We should move to this. Mention the research about we should move to this now. Move to this.
ใคร
No worries.
เรื่องที่เรา
Everything will be okay.
เรื่องอย่างอาจารย์เข้าใจพอจะรู้ตู้เองแต่รู้คอนเซ็ปต์ของแกให้รู้เรื่องกัน
It's alright. Yes. That's why. That's why.
Good.
So cute.
Right. Goodbye, please.
What happened?
It's okay. Yeah. Right. Okay.
You all can move to here for observe.
ไปยืนฝั่งนี้
To the front.
Hello
Find the subject. Neutral position. Gravity stretch. Stretch by gravity.
Kalau di stress.
Okay. Joint space. Don't need to worry. I will freeze it and set it. Be focused. I promise them will give them the image for today's lectures as well. Yeah, don't worry. That's why I need you. Nomination. Rest. See? To have assistance is very important. Rest. Don't type any type. Yeah, just rest. Join. No, rest. Resting. ST. Yeah, good. Then press here and save. Okay, good. And breathing. Okay. When you give him a little bit stress, you need to move the probe a little bit to the distal. Okay, freeze. Is that painful? Okay, mild. See it. Mild. Okay. Safe. Good. It's okay. We can do this again. Okay. Okay, resting. Right. Freeze. Okay, don't worry. Use your finger on the screen. Where is the joint space? Good. And okay. Right. Stay here. Okay. Painful? Freeze. Okay, defreeze. Painful? You're not right? Okay, just relax. So I know what is the range for his tonus. So you do a little bit practice about his feeling. Freeze. Okay. Tight first. Moderate. Okay. Then measurement. Okay. Two measurements. Okay, safe. Find the rest. Okay, good. Okay, so the distance between the medial condyle, is that increased during the moderate? Almost the same, right? Okay, that means the probe does not move a lot, but there are widening of joint space. If the the distance between the two bony markers change, that means probably the probe displaces. There are displacements of the probe on the skin. Basically, I should see, right? But so it's okay. Right. Okay. If you compare the injury side, there are 1 millimeter, sorry, of side-to-side differences. That means the MCL is torn.
Just one.
Okay. Now, ready. Get into the cube, and student in here, get in the cube, and student over there. Sorry. Waiting in this cube. Yeah. Okay, we are going to practice. So you can help him, right? You can help her, sorry. Okay. And I'm going to help student here. I need to train a student audience today to be my audience, to be my assistants right now. So you. No, you. Oh, yes. I will try to say. And like him. So you are going to do everything like him. Okay? You are working next to it. Okay. Fine. Someone. Now. Good. Thank you. Can you get up a little bit? Good. Thank you. Okay. Good. Right. Okay. You are the first guy to test her. Yeah, if you know anything, I will make you know everything. Okay. This is left side. This is the proximal part. Okay. Use your finger. Where is the joint space? Where is it? No. Put it down. Put your finger on the space.
Can you see the space?
Do you know where is the space?
Yes. Can you see the space?
Dark. No. That's up there. Up
Where is the space?
Good.
Okay. Marcus, stress, yeah. Which is one, yeah. Okay, accelerated. Straight, external. Wider. More.
อาจารย์คิดอาจารย์คิดเรียกว่าธรรมะนั่นเป็นคนเรียกธรรมะ
It's wider. Okay, because there is echo acoustic shell. Yeah, this is kind of.
เขาจะมาวันที่การ
Yeah, but the real gap represented by this is an acoustic
มันสูง
shell.
พวกนี้ใช่
มีวิธีไม่ตอนนั้นบ็อกเซอร์ก็อยากเป็น
Right? In the very beginning, it's about here. Now, under the stress, yeah, it's wider. Wider. Okay? Now, next. And you. Come on. We will have only 10 minutes for practice. And we finish. People who cannot practice, I don't guarantee you any opportunity. Yes. Okay. To help her to breathe. Okay. No. Your hands, not mine. You freeze? You freeze, yes. Okay, stretch. You freeze. Stretch, now. Now, wider. Freeze. Good. Just a little bit. It's okay. Don't make any hands. Right, okay? Okay? And you compare the size differences. Okay, you sit up. You become the assistant. And someone become the subject.
Okay, come on, take turn. Do it. Faster.
You okay?
เฮ้ยทำด้วยไม่ใช่มายืนเมาส์อย่างเดียวมิสเตอร์เคนนี่ในกระเป๋าได้สั่งมาคืนที่ด้วยก็ได้อยู่ในกระเป๋า
翻这个公妈口。
เขาเจอหัวเฮ้ยเดี๋ยวเขามีอาจารย์มีป่ะมีเขามีจิตต้องอยู่ประจำรถ
Yeah, it's good. It's here. You are middle here. But we need to just for the research. Yeah, for the purpose of the research, we need to include the media conduct. Yeah, we need to include the media conduct.
ดูสิอะ
Are you okay?
So we can reduce the box. Another. Then more. Okay. Medium come down. Freeze. And we acoustic shadow. So because you know this is acoustic shadow, so you are able to know this is the gap. Okay. Now, how many people have you practiced? Okay, keep walking. Yeah. We have 5 minutes left. Yeah, try to do the medium. Try to do the medium. Medium come down. Okay. Good. Freeze. Good. Where is the gap? Good. Okay, then carry out the switch. 3 minutes. Okay, straight. Okay, relax. Okay. No. Do not do anything with the throat. Breathe. Your hands need to be very steady.
ให้มันระวังไม่ย่อ
Very funny here. Okay? Now you didn't find the ball. Form is really neutral. Neutral. Right? That makes different. Okay. Stretch. Breathe. Good. Opening. Okay. This one. Very small. Okay. Okay, this one. Okay. Right, next. 1 minute. One subject, one testing for each group.
อันนี้วันชุดที่ฝันเลยทำเลยอ่ะ one subject please one subject please
Okay.
บีบบนนู้นบีบบนโรบตีตายเลยใครสอนบีบเป็นตัวไหนเนี่ยซับซ้อนพอแล้วเดี๋ยว
5 Newton. 5 Newton. It's just a gentle stretch. Gentle, yeah. Yeah, but sometimes for the people have injury, the gentle stretch open the gap is very obvious. And sometimes there are infusion coming from the rupture. Yeah. Like a screen. Yeah. Yeah, okay. Okay. The space is here, but we need to include the medial condyle. So we find the medial condyle and we find the collar. Don't be nervous. Got it. Alright? It's two medials, right? It did the worst. But now, right? Okay, stretch. Harder. Okay, good, please. It's a opening a little bit. Right? Not too much. Okay, so back to your seat, please. You stay.
Okay.
Yeah. Okay, back to your seat, please. Don't feel sorry if you have not, if you don't have the opportunity to do that. We will give 10 minutes time for practice for each calorie. Right? Okay.
Never still looking at me every time. Of course. You are his student, right? Ngeliatin dia terus tuh.
Become, if you want to become a master in this testing, you need a little bit of remind. So I'm not going to do this for you, because if I can do it, does not mean you can do it. If my assistant he did not know anything 5 minutes ago, just like you, if he can do it, you can do it. And I'm not going to help him because I'm going to be his assistant. Okay? That's what I teach in my class. I'm not going to show you I can do it. I'm going to persuade you or let you believe your colleague can do it. They can do it. You have no excuses to do better than me. I don't want to be a role model to you. I don't want to be a role model to you. I want you to be the role model to yourself. Okay? Right? Hold the pose. Okay, you hold it. Okay. Doing the testing. Do a little bit this kind of movement as well, because the humerus, the underbone is moving lower, right? So the probe need to go with the underbone, because humerus is steady, so you don't need to move the probe, but you can move the probe according to the angle of the underbone. Okay. So, don't worry, look at the screen. No? Put your hands on it. Okay, we are ready, right? We are ready? Okay? No? The best way to hold the probe is hold the probe and hold his elbow. Yeah, so yeah, good. Good. He know he need a good position. Okay. Since you are my teacher already, but you are my student already, I need the media contact. Okay. More like it. Good. Little bit. Just a little. Okay? And I say yes, carry out the stretching. 1, 2, 3, stop. Stretching. Next time. That's beginning. So why here become a little bit unclear? Because the probe did not go with the animal. Okay, one more practice. You know what I mean, right? Just gently, do not worry and to make too much movement. You don't need a lot of movement. Just yeah, good. Okay. Right? Don't worry about the media command. Just put it media command in the left side. tiger, easy tiger. Okay. Stop. Stretching. Good. So it was like that. Good. You can do that. You have no excuses. And no, we need to go to the next one. Okay. You can stay here and you can back to your seat. Thank you. Yeah. And we need someone with shorts to mention about shorts. Oh yeah, thank you. Yeah. Maybe 5 minutes. 5 minutes. Yeah. We start the lectures. Okay. There will be a student. There are 5 core skills today. So we need to have 5 students for this skill today. So you can teach and you can share the skill for the MCL if there are some students or your classmates they are interested. Next one, we are going to train people. They know how to measure the MCL. I need someone with shorts. Hello? Hello? Okay. Equal analysis. Okay, let's sit down. Right, let's start it.
What is your area of sensitivity? Okay, MCLT? No? Different area, region of the body. After vicinity. After this one also? Yes. Also the same one we have today.
So what will you do? What will you do?
What is the research about?
Only ultrasound imaging or to have any interpretation?
That's what I mentioned only. Yeah.
If you want to repeat the skill I just told you, please remember elbow, 90 degree of flexion, and the forearm in the neutral position. If there is any supination, pronation, you will miss the joint space when you are doing the checking. Okay, so the format for the assessment is include the humoral chocolate and also the tubercle of the almond. You need to find the structures for your checking. And measure 3 times in 2 conditions. One, resting, the other is under stress. And looking for the performance in the non-injury side as well. If there is a side-to-side differences over than 1 millimeters, very helpful to confirm UCL injury. We are not going to make the diagnosis. We use the widening of the joint space to has a hypothesis about joint ligament laxity. If there is a hyperlaxity probably support a diagnosis with the MCL tail. What is the gold standard for the MCL tail? Gold standard, oscilloscope, MRI. Why? There are 3 bands in the MCL. We are only looking at the anterior band, right? There are 3 bands. Please remember that there are 3 bands in the MCL. So MRI, oscilloscope is the best, are the best, and the golden standard. But evaluate the joint space widening with dynamic ultrasound, support the medical doctors to refer the patient to the radiologist. And they will like it very much. So, I understand a lot of people, they are afraid of, a lot of physical therapy, they are afraid of medical doctors against physical therapies to use ultrasound. Of course, they will against if you use the same scanning skills, right, for same purposes, to make diagnosis. Of course, you will have trouble. But if you using the ultrasound for dynamic testing, but dynamic evaluation, the main purpose is looking at the mechanical property of the soft tissue, and sometimes the mechanical property change support a tear, that is okay, and help them to refer the patient to the radiologist. They won't confuse about your work, they appreciate your work. Yeah, that's why I was invited to teach at another hospital and make the whole process quicker than before. As I told you, the first time, the time between first interview to the medical doctor and the first time to see a physical therapist, I reduced the time to 30 minutes. And the patient willing to pay more, but hospital does not pay. But yeah. So okay. So the hospital where I work, NTU Hospital. NTU Hospital is the best hospital in Taiwan, and they notice that, and they say, okay, you do that at NTU Hospital. I say I'm not going to teach medical doctors at NTU Hospital because there are a lot of doctors. They are already good in ultrasound already. So I'm prepared to teach. I would like to teach physical therapists to use ultrasound. So very similar to here in time. Patient pay maybe minimum to see a physical therapist. About, for example, 50 baht at NTU Hospital. For example, 50 baht. 50 baht. Do you know how much I pay? It's not a lot, but do you know how much it costs my patient to see me? Because it is NTU Hospital. NTU Hospital cannot get money from the patients because NTU Hospital is supported by the government. So government say your income cannot increase over 5% year by year. The maximum for us to increase our income 5%. My patient need to pay 1,000 baht to see me. Yeah. It's not a lot of money for the patient, but it means something. Physical therapy who know to use ultrasound will be appreciated by the hospital, by the colleague, not instead of causing confusing between physical therapy and medical doctors. As long as you remember today's lectures, dynamic scanning is our core. Okay, what is our core next? MCL Vargas test. Similar to the elbow. I'm very close to an expert right now. You tell me the MCL. And MCL again, in the knee. Yeah. And what is the next structure you thought about, you think about in your brain? If you get it proven, you will be very popular. You will be the role model, to yourself. Good. Right. If there is a joint space widening, the sensitivity for the MCL tone pair, superficially, is close to 90. The spasticity is close is over than 90 for MCL. So it is a very important skill for physical therapists to evaluate the joint space widening during the vagus stress and to evaluate the mechanical change in the MCL. Okay, how to perform that? Supine, knee and hip slightly flexions, close to 20 degree of flexions. Slightly exaltation, just a little bit, not too much. And find the MCL and also the retinaculum and evaluate the joint space in the longitudinal plane sent to the MCL in the elbow. And if there is a joint widening, that support a diagnosis of the MCL tear. This evaluation is supported by the X-ray. During the X-ray evaluation, they give the knee vagus stress and take the X-ray image and found they are highly correlated between the ultrasound result and also the result gathered from X-ray. Right. During the vagus stress, they are widening of the joint space. Good. Right. I'm going to show you how to do that, and I'm going to show you the skill between medical doctors and the skill between the physical therapist. Right. So, do.
Very strong.
Okay. Give his knee vagus this one. Okay. Thank you. And I will be your assistant. Okay, afterwards. Yeah. Hip flexion. About 20 degrees. Okay. Okay. Put your hands on. Good. Okay, find the joint space. Okay. Stretch. Good. Good. See the video. Right? In the beginning, you measure the distance from here to here. Okay. Here, we join space. Good. Widening. Sincere. Narrow. Wide. Narrow. No, you have to do the comparison. side to side differences. Okay. Yeah. Okay. So sit. Over the floor. Okay. Okay. Yes, good. You find she finds the space already. Okay, sit down, please. Sit down. Don't worry. And that will be my job. Okay. Hey. Ooh, yes. Okay. Yeah, good. So remember this one? Slight flexion of the hip and knee. If you are doing the testing in a straight knee, the displacement will be minimized. So you may underestimate the laxity of the MCL. So the hip should be slight flexion, and there will be a slight flexion in the knee. And we hold. Okay. Wow. I think this is more than your, yeah. Good. Please. Oh, thank you. Right. YouTube can help us do it.
เอาเครื่องนี้เอาเครื่องนี้ตอนเขาทำแล้วเขาแบบ
In this group, it's most reliable. Who is the fastest man in this group? You. You trust him or you trust him very much. Okay. Try to see. So you are going to be my assistant. And you are going to be her market space. And I'm going to call you forward. If everything goes through very smoothly, then we change our positions. I will give you assistance. Good. This is very expensive. It's 5 centimeters. Very expensive. I will teach you very well. With very good green. Okay, straight here. Yeah. They are injury in the MCL. Okay, don't worry. You start the Marcus. Right now, good. No. See? Go. Yeah. Okay, relax. Okay. Right. You hold it. Here. Okay. Space. Okay. Hold the floor steady. No worry. This will be better.
ต้องไหล
Okay. And look at the probe. Look at the probe. Not look at the screen. My job, our job is to look at the screen. Your job is holding the probe.
ดีกว่าพร้อมเลยเริ่มเนาะ
Got it? Got it? It's wide open, right? Good. You had injury before.
ที่ทางเนี่ยตึงเนี่ยตึง
You had injury before. I don't just use my hand. If they are supported here, they probably stop me to do the bottle stage.
ยังไม่ได้ที่เลย
Classmate over there, they ask me a master skill. What happen if you have one person just like you, very poor guys, doing all the job without any help? You can do the MCO test like mine. Okay. Okay. Just hold the probe. Use your body as the axis. Doing the slide bending. Fine. Slide bending. You're slide bending. I'm doing the body test. Okay. If you have only one person. Sorry? Oh, it's okay. It's you can use the free fingers.
ใช่มือขวาจับมือซ้ายนี่
Okay.
คือทาง
Right. Stop. You have 10 minutes.
มือขวานี่ก่อนเอาหมอนมาลองเอาขาเนี่ยลองดึงโอ้ย
One person skill. Goodbye. See ya.
เราคนเดียวเลย
โอเคมา
One person skill. Okay. Second.
Ini kan mana kau ya? Aku kan itu.
Okay, got it. Got it. good. All day. Good. Marcus.
Hai câu à? Chết đi chị.
We didn't record it.
Good. Next. One. And we will have one more subject, and we will start another topic. I think good. Yeah. Good. So one student know how to do the MCO with the elbow, good in the knee, and I will train another one for this year.
I will learn from them.
Don't worry. Just ask them to do it. Do it for me. Good?
He's pregnant. That's sweet. Pregnant baby.
Not smart is one thing. Immature is another one. Good. Right, so one person must be skilled. Yeah, very good. Good. I like that. Okay. There are meniscus injury. This will be my subject. The volcano, right? Volcano. Okay, do the Marcus test. Gently. Widen. Okay, stop. The increase of the joint space is too obvious. Too obvious. So it's one year and the MCO injury. Okay. Okay. Student, please sit back to your seats.
กลัวเปลี่ยนกลัวเปลี่ยน Sure, I have you okay? No. It's very difficult.
Supply. Like.
Right.
Good.
You are so excited. Good. Good.
real patient.
According to my experiences, student lost conscious about 15 minutes after the lectures. So I have to teach them everything important within 15 minutes. Because after 15 minutes, they were lost their conscious. But you didn't. It looks like you are so excited. Good. Really?
Yes.
I start to lose my conscience. Okay. If I teach, when I teach at a Catholic university, okay, patient, and this is the case. Okay. Do you have any pain in your knee?
Yes.
Good. So, where the pain occurred?
Last 3 years.
Okay. Do you have any trauma? Do you have any trauma history?
No.
You don't have any trauma history. Do you have?
This screen. Oh yeah. This screen.
Okay. And have you play any sports?
Badminton.
Badminton. So this is media contact.
Kecil sama aku. Nih, terus. Kata dia. Kata dia. Kata beli.
Okay. And here is the tibia. There is a conical irregularities here. That means the injury, chronic injury in the MCL. Okay? That's what I teach medical doctors. Get information to support a diagnosis from static image, because I have to complete 12 to 15 static image in 10 minutes or 15 minutes, and we complete my report to the senior doctors for following arrangement. Arthroscope repair, MRI check, operative repair, physical therapies, or injection. So, if I ask you to do position changing from sitting to standing, standing supine, it's not possible. See? That's the differences. If I teach medical doctors, we are looking for evidence for diagnosis mainly using static imaging. But now I'm checking there whether or not there are abnormal circulations around the MCL. Right? Okay. But there are something strange in here, because there is an extrusion the meniscus come out. Extrusion.
Ken, are you okay? Go to Golden Jubilee Hospital.
Okay. So, if there is extrusion, right? If there is extrusion, that means the deep layer of the MCL is affected, because deep layer of the MCL is responsible for the fixation of the medial meniscus. So we have to check the deep layer. because we don't have any significant finding using the power Doppler, I would predict or have a hypothesis about chronic MCL injury, especially in the deep layer. So it needs a lot of functional training to maintain the knee stabilization, just in case the situation of the meniscus extrusion get worse when I teach physical therapists. We get the information for the decision making and the treatment plan. Okay, we don't get the information for or to support the diagnosis. When I teach medical doctor, we looking for evidence for diagnosis. But when I teach physical therapists, we looking for information for following treatment. Sensible, right? It's rational, right? It's our authority to do in the physical therapists. Good? The meniscus extrusion. Meniscus extrusion in static position need to be evaluated in dynamic situation as well. That will be next lectures. Yeah. So you stay here. You stay here because you have an MCL injury. The ACL will be a very interesting topic. Right? Okay. You back to your seats just for 5 minutes, and I will need you. Yeah. Right. If there is an injury in the superficial layer of the MCL, there will be a phenomenon of joint space widening. If the injury is isolated in the deep layer only, there won't be a joint space widening. Okay, so even though he complained or someone complained of knee pain, and there is no joint space widening, does not mean the MCL is intact. Because if the injury is isolated in the deep layer, which accompany with twisting of the knee movement, is very frequently, okay, there is no phenomena like joint space widening. Okay, please remember that. Even though the joint space is not widening, does not mean that MCL is intact. You need to check the deep layer of the MCL as well. But since there is an extrusion, so I'm pretty sure the deep layer is injured. Okay, so the dynamic ultrasound testing the knee MCL, basically the idea is from the okay, so basically you use dynamic. The idea using ultrasound for dynamic MCL testing is coming from it come from the radiology study. Okay, so basically if the side-to-side differences is more than 2 millimeter, it's 2.3, but I just use 2. If the side-to-side differences is more than 2 millimeter, that support a diagnosis for a superficial layer injury in MCL. Okay. Okay. So one study show if there is no side-to-side differences comparison, that if the injury side show the gaping become or greater than 3 millimeter, that support a MCL injury. Yeah. Support a diagnosis for MCL injury. Because usually it is 1.5 1.5 millimeter in the contralateral side. But I use side-to-side differences for the medical doctor's training, yes. And also for the physical therapy education as well. So please remember, isolated deep MCL injury does not induce the joint space widening. Right, the most interesting part, ACL. Okay, the hospital, the Catholic hospital where I work with medical doctors, we use ultrasound to look at the ACL. Yes, during the operations. Because why is that? Because when I teach them, I use static ultrasound image to support a diagnosis. So they need to learn how to use ultrasound to look at the ACL, right? So to confirm it is an ACL, and we get it from ultrasound, we need to make sure ultrasound is included. ACL is included in the ultrasound image. So we confirm we are able to use ultrasound to look at the ACL during the arthroscope operations. Yeah, we make we tie the ACL during the operations, and we pull an ACL. And during the imaging, we are able to find the location of the ACL. Okay, we published that article as well. Right, but when I teach physical therapists, we are not going to confirm ACL during the arthroscope. We use dynamic scanning to confirm whether or not there is a tibia translation during the dynamic test. Okay, so see the differences. We gather information during the dynamic movement to have the evidence to support a mechanical property change in the soft tissue, and we use the evidence to explain the functional defects, and also use that change in the mechanical property to plan our exercise and the rehabilitations. So there is a study showed that physical therapists in Netherlands, Dutch, right? No, Netherlands, Holland. Dutch is German. Kind of, not really German. Okay, so thank you. So the physical therapists use ultrasound for their clinical work. They give more exercise training to their patients. Okay, physical therapists in Netherlands, they use ultrasound in their clinical work. They give more exercise to the patients. So that probably indicates or imply the physical therapists good at the ultrasound scanning. They recommend more exercise than modality. Okay, right. If we suspect the patient got an ACL injury, or we want to check whether or not they have ACL laxity problems in their knee, we ask the patient to prone and fix the knee in a flexion angle of 25 or 30, like this one. Okay, I think we got a pillow, so we can use that. Okay, then definitely we need two persons. One person hold the probe in the medial condyle above the level of medial condyle and the tibia, and another person just push the tibia forward. anteriorly. So physical therapists are able to see the displacement of the posterior tibia. Basically, this is resting. Okay, when the depth over 5 centimeters, you are recommended to use curved probe. If the subject is quite small, the length, the depth is not deeper than 3 centimeters, I will use linear. That's why this picture shows linear, and this one use curve. Depends on the size of the subject. Okay? So if you noticed, there is a translation of the tibia, and the translation make the depth of the tibia bone increase. That suggests a phenomena of ACL laxity. Okay, so side to side difference is greater than 1 centimeter, 1 millimeter, sorry, 1 millimeter. Support a diagnosis of ACL injury. Easy, right? 1 millimeter, 2 millimeter, 1 millimeter. Easy. Got it? Let's do it. Hey, we need you. Thank you. No, we need you. We need you. Oh, yes. 2. Yeah, 2. And you can for 1 for your neck. You can have a break. No, you are going to crawl, so you are not going to use it for your neck. So, we need a third people to learn how to use it. Ultrasound to scanning the ACL. Whose birthday is August? Who? Whose birthday? You? Alright, okay. Whose birthday? Who? You? Okay, you got the first one, and you got the second one. Okay, who is going to have the birthday in September? No? Okay, July? No. Don't force me to look at your ID. Okay, please have you. Yeah, thank you. So I'm going to hold the probe, and you are going to do the depress the tibia head. Okay. Yes, probe. Which one you get injured? Yeah, so face down. Oh, head is over there. Yeah, thank you. This one. Right. Oh, this one. Okay, it's great. Alright, okay. This one's get injury. And we are going to have a break after the demonstration, and you can have a break afterwards. Then we can start your practice for the ACL. Right, let's decide the probe. So the ankle is in the air. Yeah, the ankle is in the air. Okay, you hold the tibia bone first. Then press you.
No, thank you.
We got the tibia. We got the tibia. Got the tibia. I'm going to move the probe so tibia will appear in the right side of the image. And now we need the medial contact. Tibia and the medial contact. Come on. Not easy. It's okay. Where is the medial contact? Very See? Good? No. Okay, you can hold it easy. Yeah. Good. I'm going to reduce. Oh. Wait a minute. I think it is a spatial function here. Become wider. Okay. Breathe.
Kok sepanjang ini?
What tibia apa? No, it's not tibia.
Initial baseline. Baseline, 0.9. And this. This is the tendon of the semi-membranes. Safe. Okay. Because this is the tendon of the semi-membranes, so that means the bone here represents the medial tibia. Okay. Good. Okay. Stop. Push. Push. Okay. Relax. Good. Change the probe. Please. Yeah. Change the probe is probably better. So when we move it back. Please back. Sorry. We are in a hurry, sorry.
You know why I'm laughing all the time? Because the professor said, this is the medial canal, this is the bone. And I think like, how did he know? Like, always like, this is the bone, this is the bone. How did he know?
Yes. All right. So
seems easier, but I don't know.
it's because we use the bone mark. I mean, the bone mark is the medial tibia, because in the medial tibia there is a bone mark of the insertion of the semi-membranes. So we use that bone mark for measurement of the tibia translations. Okay. Spine.
Tiba-tiba
Right? It's so that will be more. Okay, it's very clear now. So okay, breathe here. and find the media condyle. Okay, and find the media tibia. Okay. All right, save it. Okay. Okay. Ready for the 1 minute? 1 minute. Okay, and push the tibia anteriorly slowly. Okay, but relax. Oh no, there is no too much movement, right? Okay, one more. Okay, relax. Okay. So make sure we got everything we need. Okay. Again. Slowly. Slowly. Relax. Okay. The ankle need to be in air, yeah, not supported by the below. Okay. Find the tibia in the line, and then we need to find the medial condyle in the left. We got it. Okay, push. Okay, relax.
การที่มันเป็น ambient ambient translation ไม่ใช่
Relax. Okay, relax. No worry. Okay. Okay, here. Okay, push. Push. No movement. No movement. It's your body intact.
still have something left
Okay, so if for medical doctors, so we will find out the lateral condyle. We will find that's the condyle notch from behind. Okay, this is right, left. This is left side. Left side in the left. So this is lateral condyle. Okay. And this is ACL. Okay. And this is medial condyle. And this is PCL. And you can follow the track. See? And you also can turning the probe. Erase. for the whole ACL. Easy, right? So when I teach medical doctors, they need a skill like this one.
I think wake up.
Find the groove between the canal and turning the probe. Find the alignment of the ACL. Yeah. And measure the thickness.
Thickness of ACL.
Okay, I will give you this image if you are interested. Okay, because this skill has been published already, so you can find it. UMB, ultrasound medicine biology, integrative approach of the ultrasound scanning for the whole ACL. Okay, so that's the skill teach to medical doctors. Okay, but since the thickness morphology is okay, well, that's why we didn't get any significant finding. Has anyone got an injury? You? Sorry?
Already surgery done.
Is it 2 bundle or 1
1 year
bundle? Is it 1 bundle or 2 bundle? Repair.
Yeah, already.
No, I'm repair with 1 bundle or 2 bundles. Yeah. Is this like this or it's one? Patient who are not happy with their operating result. Yeah. So my colleagues were said to me,
It's the condyle. Medial. Yeah, it's more clear.
Right, this morning is about abnormal circulations, right? And we can check for her. 1 year. If the 1 year, right? So should no circulation at all. So surrounding in the area surrounding the ACL. Good. Good. Okay. No. And PCL because this is medial condyle, that's PCL. This is lateral condyle, this is the ACL. The restricted ACL is not the bright as the PCL, uninjured PCL. It's okay, don't worry. Then, you feel knee pain?
No.
Is there any limitation in your knee extension? So the 2 legs are the same straight. How about the angle of the hyperextension? Are they the same? Can you check for me? the degree of hyperextension. There are limitations. Because the PCO is here. Look at it on the screen. PCO is here. The PCO is okay, but there is spur in here, very close to PCO. That means sometimes in a normal hyperextension, you may feel a little bit strange in the back over here, since you don't have any experience in that. So there is a limitation in the hyperextension. Okay, in this case, are we going to give her any exercise for hyperextension to restore the knee mobility? Because as a physical therapist, we want to restore everything from with their range of motion. If there is a limitation in the hyperextension, we used to, and we always do, to increase the hyperextension angles. But in her case, are you going to do that? No. Why? You need to have evidence. Right? Maybe our hyperextension exercise may cause her discomfort. She needs to be aware about this, and we need to talk about this with other doctors, and we're willing to monitor the change of hyperextension by 2 degrees at once, because at least 5 degrees. At least 5 degrees. So we are not going to stretch the knee over 5 degrees, around 2 degrees each time, to have a gradually improvement, not improvement at once. Just in case we like to protect the PCL. Right? Okay. Well, again. Terrible PCL, right? There are a lot of bone irregularity. Right, let's back to the ACL. That's lateral come down, and I'm going to move the toe from lateral to the medial, and we are able to see the reduced size of the lateral come down. Okay, then the ACL here. Find the thickness of the ACL. Just cut it, check it. I would assume it is too long. Assume this is too long. You can check your records with your doctors.
It's too bad.
Because okay, say erase. Erase. AM. PL. So I would assume that's 2 1. Good. Yeah. Right. TV translation. Okay. You can. Okay, classmate, may I have your attention, please? Go. Push, 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 push. Please. Yeah, there's a little bit. Good, thank you. Right. Yeah, a little bit. So the fixation, the reconstruction is very good. Okay. So we'll have 5 minutes break. Because
Even in class, I don't understand anything.
5 minutes.
Okay, fighting. Yeah, good.
Everyone is cheering.
Yeah. The advisor behind you.
We don't finish.
The very doctor also
That's
paid.
hard for all. Why you choose this topic?
เลือกอะไรใช่ไหม Shoot the topic.
In the literature,
Yeah, why you choose this
ทำไมถึงเลือกอันนี้
You
advisor
interest in this
มัน
one?
เป็นเรื่องของ advisor อ่ะ
อ๋อ it's a topic for advisor
advisor
and the part of I think it's a part of his big list
yeah my idea
You have a member other two. Despite you, you have how many like members?
member
Yeah, in the lab. Only you.
maybe
So, I just wanted FVC only you.
yes
have a break.
only me
จะมาว่า
สมมุติ
You should ask Hassan. She's very good in cyber I think you can, but you didn't. Yeah, but you didn't pay off because you have basic. So
Yeah, that's right. That's why I
ไม่รู้ผมไม่ได้มีคือแบบมีมูฟแบบแล้วเราไปเจาะคนทำอะไรเงี้ยตัววีเลยไปซะ
deeper than 3.
ใช่ผมคือรู้ว่าไม่ช่วยมากกว่า
Ankle. Okay, now welcome to back to class. I know some of the students still have their breaking, but it's okay. It's okay, yeah. Now back to the ankle. We give the ankle varus stress to test the ATFL. Varus. Okay. Okay, so there is no cut-off value, no, for the ankle varus test. But when we test in the ATFL, if the distance increased and close to the delta close to the 1 millimeter, it supports the diagnosis of the chronic ankle instability. But whether or not this 1.2, 1.3 millimeter is a good cutoff values, need more evidence to support. But we look at the joint space widening during the varus test. So basically, if the delta close to or more than 1 millimeters, that support a diagnosis of the ACL injury. ATFL injury. So basically, you find you hold the elbow, the ankle, and you put the probe above the level of the ATFL, and you give various stress. This is an ankle of a healthy one that does not move a lot, but the ankle with the injury ATFL that change over than 1 millimeters, and it is a very good cutoff value for physical therapy to have a hypothesis about chronic ankle injury instability. Right? One person, this is very difficult. Yeah, I'm not very confident about this one. Yeah, but so that's why I need assistance. Yeah, today. Right, so we need people who has ankle injury before. Okay, come.
She has, yes, from our class.
Okay, which ankle you got injury? This one will be. No, it's okay. Right. So, sitting here, legs here, ankles here. Okay.
Mending beli mobil. Balik modalnya berapa sih? You okay, Win? What's sprain kan? Sampai cannot see.
When you choose a preset for the ankle, the preset for the ankle is the same to the wrist. Okay, both settings are designed for the superficial part. So if there is no preset for the ankle, you can use the preset for the wrist. So you are the subject and also the assistant.
Only 1 hour. Yeah, already half an hour. My head is hurt. I don't understand.
Oh, this is very obvious.
Oh, Win, are you okay?
Okay. Right. See here. Oh, sorry, stay here. because I have to hold her ankle steady. Okay, when I say yes, can you press the say yes, okay. Safe. Good, thank you. It's a little bit pentaflexion. Well, that's why I said if you have only one person to do the stress and the measurement, it will be a little difficult. If you have two persons, that would be easier. Right, okay, so we distance from here to here, that's very in the beginning. Okay, then need to find out the homework in here. Here, that's what we need to know mark here. So you need to find the same point in the stress test. Okay. Got it? So back to here. Okay? And right, and use here. Okay. So you know the distance from two people may be needed. Practice. Right? Okay. What? Are you going to lose your conscious? Right. You are going to help the group in here, right? Yeah.
Yeah, TFL. The ligament that okay. TFL.
And both is fibula and ellipse.
Yes.
Now,
จะจบ2 เดือน โอเค มีเพื่อนแล้ว
okay.
ใกล้จะ100%แต่ไม่ใช่3 คนแล้วคณะก็ดีอย่างมาเป็นแบบเอเซอร์ด้วยก็ปฏิเสธไม่ได้ปฏิเสธอาจารย์จูนไม่ได้
ก็คือว่า
จบ
ไปดูกันเถอะมาดูกันเถอะ
They know me because second home. Okay. Okay. How you want to do it by yourself? Okay. You can. Good. Of course you can. Good. You've done it. Good. Next one. Wow, very good. Okay. Now, stand up protocol. Lay 2 videos. Second top. 2. The second top. Here. Lay 2 videos. Second top. It's here. Okay. This one. Okay, all of you want to use one person skill. Good. Okay. Hold the pole. Lay 2 videos. Second top. Second top. Right, is better. This is better, right? Okay. Okay. Boris. More. Okay.
นะ
Good. More force. Go. You are keeping stretching. Keep stretching. Return. Stretch.
สไลด์เสร็จเลยใช่ไหมเนี่ยไม่ได้ส่งพรุ่งนี้
ก็เรียกว่าเป็นมาถึงนี้แล้วไม่เห็นเพื่อนๆกันเต็มมาเกิดอะไรเกิด
Open well. Begin to the study position.
Medium.
Starting position before you do your stretching. Good, good. Good.
Oh, yeah. I didn't see anyone.
Classmates, do not forget wash your hands after the lecture. No, this is not correct. Very too many euros. Very too many euros. Okay, so we'll be on. Okay, switch. Okay, relax. Return. Good, 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 good. Stretch. Stretch, good, 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 good. More. Good, all day.
ใช้เยอะนี่คืออยู่แล้วครับ
Okay, return. It's okay. It's okay. But was there injury? Was there injury? Okay. So this is the resting. Okay. And then you stretch. Stretch more. Okay, return.
มาจากบ้าน
Right. The very beginning is very small. This one is very small.
ต้องมาอีก
Come on.
ยังไม่ทิพ
Right. Okay. Yeah. So there was the injury. Okay. Next one. Last one.
นี่ครั้งแรกเอาไปเข้าใจ
แต่ที่บอกมันเป็นป้องกัน
คือแบบอันนี้
ของคณะอะไรถึงได้ทำเรื่องคณะบริหาร
Last one.
ไปชมหัวใจในเวลาออก
มีล้างมือยังเขาคืออะไรที่ไม่ซักไม่ซักเลย
ก็ไม่อยู่แล้วเหลือเท่าไหร่สมัยเหลือเอ็มโคเสร็จแล้วเนาะคนนี้ฮิปโอ้ยฮิปดูไม่ค่อยซีเท่าไหร่ใครจะไม่สนใจเข็มอ๋อแล้วก็มีนี่โชเดอร์อีกหลายจอยเลยกับพอร์ตเอง เราต้องใส่กางเกงในตัวเดียวอ่ะยิบไป
ไม่น่าจะให้แบบดิฉันไปก่อน
ใช่รู้จักแล้ว
ไม่ดู
ไม่แต่
เพราะว่ามันจะเสีย
แต่ว่าโชเดอร์น่าจะได้โชเดอร์น่าสนมันดูใหญ่ยักษ์
My head hurts because actually I'm not into my clinic.
Oh, you look at the face of the nerve. Goes to the
We are learning clinic
it's
more
nothing wrong with
my
it.
head. Seriously.
Fighting
The
together.
small, yeah, small fish.
January.
Duck. Yeah, that's the
I'm so
nerve.
confused.
Okay,
It's your idea to learn about
finish.
for your thesis. You give him a title and he do not accept and he just give you just use it to some second.
ยังไงดีล่ะ
It's okay. How to explain?
He cannot explain for me, but he tell me
Okay, student, please back to your seat.
review paper, a lot of paper, and after talking about with him about nerve expression, how can understand something like that.
How many students?
So it's not your initial topic.
30.
It is his topic.
How many students today?
And he wants you to study about
Yeah, please sit back to your seat.
My idea.
what is your first idea?
Exercise, suspension exercise on my BMI. Go back to he told me it's not
It's
not
not new.
good idea. Yeah.
How many students today? 1, 2, 3. How many students today? In this classroom? 30? I was told 26 a few days ago. 15? 50? Oh, 15. How many here? How many over there?
Eight
31. Around 31. Okay.
So you have to
And
do this.
I often to be asked to do the test that I'm going to show you, but unfortunately I don't think we have quite time enough. So I'm going to show you one more, but probably I will demonstrate if I have time, maybe. So this skill is very important. It is responsible. It could be used for measure the internal impingement in the hip or the snapping hip. Okay, so the medical doctor, they often ask me, can I help them to find the evidence about the snapping hip, especially the internal snapping hip, because the patient often tell the doctors there is a sign of snapping in their hip, especially in front hip, but they put their side back to the neutral position from abduction, fractures, and the external. It is not difficult to make the diagnosis. But it is difficult to get evidence. You are not going to make the medical doctor are not going to make the diagnosis according to the complaint. It sounds like a snapping, so I write down the diagnosis as an internal snapping hip. No, nothing like that. So they asked me to do the snapping test. So this is the iliopsoas tendons. There are two heads in the iliopsoas tendons. So basically, they at rest, the tendon is above the superior pubic ribs. And this is impossible, believe me. This is just for pictures. This is impossible. Because when the people doing flexion, exaltation, ABD, it's a two-man's job. One need to hold the probe. One need to do the pacing movement. So this is just an ideal situation, I believe. Because this is the probe. I put it in my pubic bone, okay, ramus. When I do the abduction, exaltation, my leg is going to push the probe away. So someone need to, this is correct. But I often sit in here and do this. I don't sit in the opposite side. Because if her knee touch my elbow, that will move my probe. So I often sit in here in the same side, at the same side. So I have the force against the push from her side as well. Okay. So what may happen during our evaluation? There are several conditions. One, in the resting, during the abduction, exaltation, and the hip flexsions, there is a turning of the iliopsoas tendon and rebound to the and touch the pubic ramus very forcefully and induce the snapping sound. When the hip moves back from a posture of exaltation, flexion to the adduction, internalation, and the neutral. Okay. If they are bifidus iliopsoas tendons, that happens quite frequently. I mean, it was like that. But when the patient doing the flexion, exaltation, ABD, the two tendons, they switch their positions and causing the sound of snapping. So in this case, we need to help medical doctor to make a decision. Are we going to send the patient for injection or physical therapies? Because if a case like this, sometimes injections works much more quickly. And this one, stretching may help. Okay, we had a case. He complained about the pain in the iliopsoas tendon, and he does not have any snapping sound. And we found the bone spur on the superior pubic ramus. So he had a symptom very similar to snapping here, but without snapping sound. And ultrasound helped us to find out, all right, in this case, injection is very, very useful. And he does not complain after the injection. So, know how to use this scale is very important, but we were looking for another opportunities because you need to do a little bit sports. Right, okay. I would like to go very quickly with the resting slide. There are a lot of physical examination can be combined with ultrasound. And these potential physical examination need your efforts, your time, your practice to prove they can be used. Okay. And one, I asked the artificial intelligence, which is the most potential physical examination for us to use ultrasound to prove. And the AI suggests the external rotation leg sign. Not too bad, because this test is designed for the tail in the infraspinatus and the teres minor. And we are able to use that ultrasound to look at the gliding of the infraspinatus and the teres minor. If there is a tail, the gliding will be intact or defects. It's suggested by artificial intelligence. Not too bad, right? Not too bad. Okay. So this is the example given by the artificial intelligence. I don't use that very often because I need to spend time to look at the accuracy of the information. But this one, I like it. Okay, so if people who show the externalization leg sign, they are not able to hold a position with externalization. It is very worthy to use ultrasound to look at the intact of the infraspinatus tendon and the teres minor. Okay, so just right. Okay, and another one is peroneal tendon syndrome. It's too difficult. I think we need to close the lectures. But before close lectures, I would like to show you the gliding of the teres minor and the infraspinatus tendons. I need a shoulder. Who can give me a shoulder? I need someone to explore his shoulder. One, need a chair. Thank you. Come on. 1 minute. 1 minute. 1 minute. Take off. You. He is going to do for you just once. The second time you need to pay. Okay, this one. This is the tendon of the infraspinatus. Okay. Please do the external rotation slowly. Good. And back to the normal. Back. Okay, we are going to do again, just for the audience today. Okay, return. This is infra. Yes, if we do that, because teres minor is lower. Okay, do that again. This is teres minor. Again. This is teres minor. This is infra. Ah, you got injury in infra. Okay, return. Again. Again. One more for the teres minor. Okay. Good. It's under the tubercle. Okay. This is right. So people who show the external rotation leg side, then may have the tear in the infraspinatus tendon and over the teres minor, and you can use the ultrasound to check. Okay, that will be the end of my classes for today.